Thanks, Carol. Thanks, Tom. And last but not least, I'd like to introduce our university representatives of Kyle Chapman and Cass Mosely. Kyle's a director of Oregon Tech's Air Center and an associate professor of sociology and population health. Kyle leads a team of researchers tackling issues related to human health and the environment in Southern Oregon with a specific focus on air quality. Cass Mosely is the vice provost for academic operations and strategy at the University of Oregon. She chaired the USDA Forestry Research Advisory Council and was UO's chief research officer, where she oversaw most multidisciplinary, multi-strategic research initiatives, partnerships, research centers, and institutes. And she's going to be talking about UO's Smoke Center. Great. Cass, Kyle?
All right, thank you, everyone. So I'm Kyle Chapman. I'm a professor down at Oregon Tech in Klamath Falls. You've heard it mentioned a few times. Rick pointed out we had a really good year last year, so super happy about that. So I am just going to introduce you a little bit to a new research center that's been developed down in Southern Oregon. I know the focus here is mostly Western Oregon, but down in the south and into the east, we still have lots of issues. So we essentially got some funding. We were lucky enough to get some congressionally directed funding last year to tackle a project that had been developing for a while related to hospital burden and air quality, much like the OHA has been investigating. And we've sort of used that platform to kind of expand into the region because there just are not as many resources down in Klamath Falls area as some other parts of the state. So I just want to give you an overview of some of our goals and things like that. So first, we really want to invest a lot of time and energy to understanding the unique characteristics and things that we experience related to air quality in Southern Oregon, and particularly in the Klamath Basin. We have poor air quality a lot of the time, even in the winters. We're one of the only regions, if I remember, we're still out of attainment. We're getting closer, but some of the interventions that have worked in other parts, like mentioned in Oak Ridge about the reduction of wood stoves, haven't been quite as effective in our region. And you combine that with widespread wildfires, and we have pretty poor air quality consistently. So we want to identify a range of environmental threats, particularly with a focus on air quality, and then some of the key health risks. One of the difficulties of trying to understand health in a very rural region is that you just don't have a lot of cases, and so you have to put years of data together to understand what's going on. And when you do that, you have a big variety. Some years we have really good air quality. Some years it's really, really terrible. The sort of goal of the Research Institute is to work with local and state agencies to try to develop a more robust monitoring system related to air quality. We have secured some funding to try to develop more of that type of monitoring systems, not just PM 2.5, but chemical composition as well. So we now have some filter-based systems that are going to reside on Oregon Tech campus. We're going to have indoor air quality filter-based systems as well to better understand not only the concentration of PM 2.5, but the chemical composition as well. And that's about as far as a sociologist can get talking about chemistry or biology or anything like that, so I'm going to stop. But we do want to develop a more robust infrastructure in Southern Oregon that we can then lend and work with organizations like the DEQ or agencies. And then our big focus is then applying those pieces of information that we get. We're a polytechnic university, so everything we do is really applied, give our students experiences working in these areas. We have a lot of engineering students and allied health students that are getting involved in these projects, and they never thought of public service as maybe an avenue that they wanted to go, or environmental issues and solving problems as a direction that they might want to take their career. And so that's a really important piece for a school like Oregon Tech. And so we're just going to continue to do that. I wanted to just briefly show you a list of some of our ongoing projects. So the things that we've been focusing on for the last few years is estimating hospital burden regionally. So we've been working with Asante hospitals in the Medford, Grants Pass, and Ashland area, and then also with Sky Lakes Medical Center, which is the primary hospital in the Klamath Falls area. And so we've been looking at respiratory conditions for a while, but we've now added cardiovascular conditions and cerebral vascular conditions, so stroke and heart problems that are associated with the exposure to smoke over time. And we're trying to look at historical trends and then also pre and post fire trends. We've started off our campaign. We've had some, our outdoor and indoor chemical composition campaign has taken a little bit longer than I'd like to get off the ground, but that we have started to make really good progress there. So we'll have some really good information, especially because Klamath Falls in itself is in a basin, and there's a lot of topographical differences between people who live on one side of the town or another side. And then some of the socioeconomic differences that exist within the community as well are important, type of housing and how porous their house is, and all of those different factors. We'll have a lot better information here in about a year on what that looks like. So we hope to share some of that. And then some of the sort of planned projects that we want to look in, just like everybody else has been talking about, prescribed burns, right? The risk assessment of prescribed burns and how to communicate that with individuals, trying to get a good idea of what communities think about prescribed burns. It's pretty interesting that some communities are really on board with them and some aren't, and it seems like they're for different reasons. So we want to understand where regionally where we sit. And then there are some other projects that on post-fire vegetation that we've got people interested in, and then some fire risk assessment using LiDAR. Those are really student-driven projects that we hope to sort of build out and to use as kind of a paradigm for teaching more students about these types of issues. So that's really all I've got. If you want to contact me, stuff up there. We have a new website. It's pretty bare bones, but it's up, and you can search it. So thanks. Yes.
It's somewhat fitting that the person who's batting cleanup has no PowerPoint, so.
You can skip if you want to get.
Oh, do I? Is there?
Or you can leave me up
then everybody knows how to get a hold of you, and it'll be awesome. Okay, so thanks everyone for being here bright and early this morning. I was reflecting on some of the things that Doug was saying, and remembering that maybe 20 years ago, when the National Fire Plan got created and the cohesive strategy got first created, we were really, really focused. There were 4 dimensions to it, but really we were really focused on fuels reduction and improving our suppression response. And I think that Doug's talk this morning really represents a pretty substantial change in how we think about fire, and so that fuels reduction continues to be a key component. Those of us who work in the woods tend to think of that first, but the reality is that when we're living with fire, we're thinking about evacuation, smoke, power shutoff, home hardening, lots and lots of other things. And so the Center for Wildfire Smoke Research and Practice is really trying to get a handle on the smoke dimensions of wildfire and learning to live with smoke. And we've heard from many of our panelists, there's a lot of people in the state really focused on improving the quality of our modeling, smoke predictions. Our focus is really on the community preparedness and response to smoke events. And this, like Kyle's, this center is being started thanks to Senator Markweise's leadership because it's a congressionally directed project with funding that will come from the Environmental Protection Agency. We don't actually have the money yet, so we're a year behind you guys. And we have a number of strategies, and my colleagues, Heidi and Holly, are key partners, among others, in this project. One of them, so the overarching goal really is to think about, again, how do we support communities and households in being better prepared to respond to smoke when it comes, right? Because fire and smoke are increasingly connected, both near fires and far away. So identifying the opportunities for communities and households to prepare, looking at how communities and households get their information. Are they getting clear, high-quality information? Are they able to respond to that information? Do community strategies of communicating to their population really work? And you heard some of that discussed in the after-action review work that Holly and Heidi just described. Really doubling down on how do we communicate smoke risk and allowing people to take proactive actions. Certain kinds of populations need different kinds of information. Where is that consistency coming from? Is it, is there 27 apps and you can't tell which ones to use? Is it clear? How's that working for people? And what role do communication networks play in disseminating information out to communities? And then another major dimension really is about the effectiveness of emergency response planning and recovery. And this is actually, just to point out, this pilot project that Heidi and Holly just talked about was actually a pilot of what we plan to do, one example of the kind of research we plan to do in this center, where we're going to be able to go and do after-action reviews in close collaboration with communities in order to both help those communities be better prepared for next smoke event, which we know will come again, but also help us at policy levels to identify lessons learned that people like Doug can take back to the governor's office and the legislature to improve things at multiple scales. And I think one of the things that undergirds all of our work, which is something that is critical to all the work we do at the Ecosystem Workforce Program, which is a longstanding organization that Holly and Heidi and I are a part of, is making sure that this work is intimately tied to the work of communities and their agency partners. So we will have an advisory group made up of those agency partners and community leaders. We will be developing materials and communications that engage with those communities and are driven by their needs, and what they tell us is the kind of information and resources and tools that they need. And what I think will be interesting about this center is it really sits in between a lot of the other kinds of efforts that are already going on at EPA and OHA and Department of Environmental Quality and ODF and the Forest Service, so that we are really filling a gap in a very dynamic and rapidly changing research practice environment. So I'm going to stop there because I think we are like -2 minutes. So thank you, everybody.